Hospitals in Canada are burning through masks, gowns, and gloves in the fight against COVID-19, and there are fears of shortages. The novel coronavirus pandemic has taken a toll on those who are most needed to combat it: the doctors, nurses, and other frontline workers at hospitals and clinics. And now, medical professionals across the country are sounding the alarm. They need more protective equipment.
You can't have doctors, nurses, respiratory therapists, orderlies, any cleaning staff. You can't have us going out there and us getting sick and dying because it means there's no one left to take care of you.
And today we are going to talk on the topic of N95 mask and the PPE shortage which Canada faced in the very beginning of this pandemic. So first, let me give you a brief description on what is COVID-19. COVID-19, this term basically came from coronavirus disease 2019. The first case of this disease was recorded in Wuhan, China in December 31st, 2020. This pandemic began, maskings were recommended in Canada and all over the world. Recently, the supply of these high-grade masks such as N95 masks were limited, so that they were only provided for frontline workers, and the other public were urged to rely on the cloth masks to help limit the potential spread of this virus. However, the supply of N95 masks for frontline medical staff was caught up to demand in Canada, and the importers were more productive. So further, we will see more about the results of mask shortage and the PPE shortage, and also we will see the long term of the PPE shortage in Canada.
I found an article that kind of talked about how the government passed up opportunities to get PPE supplies as well as N95 masks. So it was proven by the House of Commons Health Committee that the Canadian government passed up an opportunity to purchase those supplies in order to help our medical professionals. So our medical professionals were super scrambling in finding the PPE necessary when the COVID-19 pandemic initially started to get progressively worse. Many businesses came forward offering Canada to provide the appropriate PPE equipment, but the government declined an offer from a major manufacturing company in the US called Honeywell, the company who manufactures N95 masks. So Canadian officials were highly encouraged to accept the offer from Honeywell. These products would have been produced at their location in Taiwan, Mexico, to accommodate Canada's needs. At the end of the day, Canadian officials said, right now is not a priority for N95 masks. A senior official at the Prime Minister's office sent an urgent message to staff members and basically told them to deal with the situation, those who were monitoring the country's PPE. Those officials just did not jump on the offer from the company at all. So Canada's principal supplier at the beginning of the pandemic ended up being just a US firm. The manufacturer became overwhelmed with the demands of its products. As we know today, we had a large shortage of N95 masks, and this was because border restrictions. Trump began to block the shipments of our masks from this US firm. So if Canada would have taken advantage of Honeywell's N95 masks, our country would have been free from border blocks, and we would have not experienced a shortage within the country.
So what did the Canadian government do to fight the crisis and to make sure that its people had access to PPE and were sufficiently protected against the COVID-19 virus? The Canadian government announced a state of emergency and developed a comprehensive plan to boost the supply of face masks. This plan consisted of internal as well as external factors. Internally, Canada made a detailed demand and supply plan for all provinces to secure and distribute existing inventory and determine individual needs. Domestic distributors were asked to sell to Canada first, and all exports of PPE were halted while Canada bought up supplies in bulk. A call to provide supplies was also made on Buy and Sell Canada. Another major puzzle piece was the so-called Made in Canada project. The government called on businesses nationwide to support by utilizing their manufacturing facilities to fight the PPE shortage. Over 6,500 businesses such as GM, Inksmith, or Burnaby followed the call and helped by collecting and donating equipment, producing at higher capacity, altering their manufacturing facilities or creating new lines of business to produce PPE, and joining forces with other businesses to produce more quickly and efficiently. By May 25th, 2021, Canada had secured over 123 million face masks by leveraging internal resources alone. In addition, Canada switched from a competitive bidding process to standing offer agreement with suppliers, meaning companies agreed to sell PPE at a fixed price to prevent bidding wars. In the fall of 2020, Canada returned to competitive procurement with special processes for Canadian businesses to boost domestic production. By June 2020, the value of face and eye protection goods imported to Canada had risen to $400 million. To put this into perspective, the import value was 13 times higher than that of June 2019. China rose to the main foreign supplier during the crisis by providing 90.7% of all textile face masks in 2020. So in conclusion, Canada was able to fight the crisis with a complex strategy of incentivizing and boosting domestic production, bidding processes, as well as investments in imports.
With regard to the future for personal protective equipment as a whole, although Canadian companies have stepped up to produce it themselves earlier in the pandemic, continuing to produce without taking into account long-term impacts, including costs, is not sustainable. Companies such as Nova Scotia Stanfield Limited, a company-run underwear manufacturer who started making PPE, has not renewed its contract with the federal government. Throughout the course of producing PPE, there was a negative result of 300,000 unused products and a forced layoff of 150 employees for the company. The company Mustang Survival, a producer of outdoor gear and personal flotation device, started making PPE in April 2020, but now says that it's fulfilled its contract and was happy to do so, indicating that they will not continue PPE production. With many companies now stepping down as the numbers of COVID-19 cases continue to lower with the rollout of Canadian vaccine plan, there is a positive outlook for the company 3M. 3M is a manufacturer of N95 masks and have opened a mask plant in Brockville, Ontario. They have also settled on a 5-year agreement with the Canadian government, which will result in many job opportunities and better the economy. Barry Hunt, president of the Canadian Association of PPE, indicated that at first it was about getting the products made. Now it's about a better product with greener standards, not just for the product. Mr. Hunt also indicates that now it's about starting to consider the ethical and economical considerations like living wage and fair trade practices and ethical workplace practices. With all that being said, the direction of PPE production in Canada is clear.
Canada is always so dependent on other countries to lead in terms of manufacturing. We've realized and learned many lessons throughout the pandemic that our country must take initiative. We relied so much on the United States, and when the US could not provide or chose not to provide, we had to act fast in order to keep our country stable and safe. With that said, Novo Textiles in BC created the first Canadian line of cup-molded masks. Similar to the N95/N99s, and these are used in healthcare fields. The company received a $1 million grant from the federal government to manufacture these masks, which will be just as accurate as the N95. A little fun fact about this company is that they were actually a pet bed manufacturer and changed focus to personal protective equipment as Canada is in serious need. So that's pretty cool that they were willing to basically change their whole company in order to help during these difficult times.